I'll just start by giving out a wee handout, which you can just pass around the room and talk through. Lovely, so today I'll be talking about endoscopy and veterinary medicine. So firstly, what is endoscopy? Endoscopy is a helpful diagnostic tool in veterinary medicine, which involves a tube being placed into the esophagus to allow for movement around the GI tract. This can aid in visual identification, diagnosis, or retrieval of items blocking the tract. Biopsies can also be taken if the endoscope has a working channel. So there's a handpiece, which is how the vet controls the endoscope, and this handpiece has buttons which allows for irrigation, suction, or insufflation, which is air. From this, there's a flexible insertion tube that goes into the patient, and this contains the working channel, which can attach retrieval devices, biopsy forceps, or loops. There is an umbilical cord, which is part of the endoscope, and that connects the camera to the light source used to look inside the patient's body. This can be connected to a monitor where the visuals of the patient are displayed and analysed. This can be useful for the assessment of organs, tumours, ulcers, inflammation, or obstructions of the GI tract, such as foreign bodies. Aside from the endoscope itself, there is some other equipment needed to help the procedure go smoothly. Firstly, general anaesthetic will be needed to complete this procedure. Therefore, anaesthetic drugs, syringes, catheters, tape, T-ports, endotracheal tubes will be needed to anaesthetise the patient. And once anaesthetised, a mouth gag should be put in the patient's mouth to prevent them from biting the insertion tube. This can be a needle cap or something that we already own in the clinic, and a water-based lubricant will be helpful to guide the tube through the patient. So why are we adding this to the clinic? An endoscope would be beneficial to add to our clinic due to the high foreign body patient cases that come through Miraval Papanui Vets. There have been multiple foreign body surgeries weekly since March, so having an endoscope in the clinic would be useful for diagnosing and potentially removing a foreign body. Not only would this reduce the cost for clients who we currently have to send to McMaster and Heap for diagnosis through endoscopy, but it would also speed up the diagnosis process, which would be safer for the patient. It may also help to identify and retrieve the foreign body without the need for surgery altogether. This would be if the foreign body was smooth, round, or small, and is something that would be safe to remove back up the esophagus. This would reduce the need for exploratory laparotomy surgeries, again more expensive for the client and high risk for the patient. This is valuable to completely remove the recovery period as patients come in for the procedure and leave without the need for any sutures or medications. So indications for an endoscopic procedure are if the patient is demonstrating any clinical signs that would need investigation of the GI tract. This would be indicated after running other tests first, including x-rays or an ultrasound. An endoscopy procedure would be appropriate for patients who present with signs of a foreign body. Although signs can vary between patients, common signs of this can involve intermittent to consistent vomiting, a decreased appetite. Abdominal pain and palpation of the abdomen from the vet can also indicate the need for an endoscope procedure. Other common foreign body signs can include hypersalivation, anorexia, and lethargy. It is also important to obtain the history from the owner to assess if they saw the patient ingest anything. Large dogs like Labradors are common for consuming large pieces of toys or bones, which can then struggle to be digested by the GI tract. One specific example of when an endoscope could have been useful at Miraval was when a patient had eaten a roll of poo bags and had to have an exploratory laparotomy at the after hours clinic. This was one of our patients who came to us during the day to recover and was sent home that same evening. However, the following day he had eaten a whole roll of poo bags again. And since he'd already had one surgery, another surgery was contraindicated and an endoscopic procedure was preferable. However, as Miraval didn't have an endoscope, the patient had to be sent to McMaster and Heap, which was very expensive for the client and meant our clinic lost profit. There have been more examples of this specific situation, as patients who've had 2 foreign body surgeries would highly benefit from an endoscopic procedure. So one contraindication of performing an endoscopy would be if the signs of a patient haven't been ruled out as another issue through diagnosis or test. This is meaning if the veterinarians would need to take further trials before using the endoscope. Patients at risk of being anaesthetised can be another contraindication, as they are more at risk of regurgitation leading to aspiration pneumonia. Bleeding disorder patients are at higher risk of bleeding or internal hemorrhage after an endoscopy, so this could cause harm to these patients. A recent GI surgery can be another contraindication, like I mentioned before, which may require caution for the vet if they're performing the procedure. Patients who have eaten within the last 24 hours are contraindicated for endoscopy due to them being at high risk of vomiting and the mucus or the food blocking the camera's view. So new equipment introduced would obviously be the endoscope and the screen, which come together so that you can see the inside of the GI tract on the screen. A mouth gag should be used to prevent the patient from biting on the tube during the procedure. And again, this can be made from a needle cap or bought new. Or the dental mouth gag, which we already have in our clinic, could also be used. Retrieval attachments and biopsy forceps can be purchased to better grasp items on retrieval, or if biopsies are needed as a diagnostic technique. Right. So prior to performing an endoscopic procedure, it is important that the patient is prepared. Due to this being a procedure performed under anaesthetic and inserted into the GI tract, food should normally be withheld for 24 hours prior. This is so nothing interferes with the camera and blocks the visuals. Oral cleansing solutions can also be helpful 12 hours before the procedure to help to cleanse the GI tract. The patient should be positioned in left lateral recumbency to perform the procedure, as it allows for more accessibility to the stomach. Anaesthetic monitoring will be needed throughout the procedure. So the endotracheal tube should be properly inflated and a mouth gag should be put in the patient's mouth to prevent them from biting on the tube. The patient's neck should be extended to ensure easier access, and lubricant should be used on the tube prior to insertion. The tube is then guided towards the back of the throat above the ET tube and inserted to the upper entrance of the esophagus. Air should be inflated into the lumen, which is the space in between the GI tract, to allow for the veterinarian to visualise the opening. Using the handpiece, the vet can guide the tube through the GI tract while staying in the middle, as it is best for visualisation. Depending on what the endoscope is being used for, will determine when the procedure is complete. Items will either be identified through the camera or monitor, and foreign bodies may be retrieved depending on the outcome. So expected results from the endoscopic procedure would be the diagnosis and or removal of foreign bodies. The camera should be able to identify objects not found on an X-ray or an ultrasound. Alongside this, there are retrieval attachments which can pull items out of the tract without the need for surgery. So there should be a recovery period for healing. This would be safer and easier for the patient, as they would not have a wound or medications to manage at home. So follow-ups required would be if there's any biopsies that have been taken, the veterinarian should follow up with the results after being sampled by the lab. Patients should be monitored for regurgitation or vomiting following the procedure, alongside any potential ulcers or irritations of the esophagus or the GI tract. There may be the need for diet change depending on the results of the endoscopy, potentially some gastrointestinal canned food, which may be easier on the stomach. Depending on the results of the endoscope will impact the future plan for the patient. This should be reported back to the owner at the time of discharge, or the owner should be contacted once the results are back. Providing the patient doesn't have any systemic diseases that may impact recovering, the patient should be good to go home that same day. However, a post-op check may be required to assess if the patient's symptoms have resolved and that there are no other owner concerns. All of our records at Merivale Papanui Vet are kept through the software Vision to access the patient's previous medical records and to know the clinical history. This is also to upload future notes, results, and information about the patient and the procedure. This is extremely important for post-operative follow-up and to understand what happens in case something goes wrong throughout recovery. Notes about the procedure and results from the endoscope, including pictures, will also be kept on the patient's Vision file. Paper charts, including consent forms and anaesthetic charts, will be used to record the patient's status while under anaesthetic. This will then be kept in a tray until they can be scanned onto the patient's Vision file. Right, so this is the endoscope that we are looking at, which is suitable for small animal gastroscopy. This is a portable endoscope with a 1.2mm working channel which runs inside the insertion tube. The length is 610mm and this comes to 8,980. We would be getting the portable endoscope 10-inch screen, which is the largest screen here, and this comes to 2,999. So the total cost for the screen and the endoscopy comes to 11,979. So for the clinic cost, I found a 2-day course for veterinarians, which was 2,999, and one veterinarian or the owner would go to this course to learn the basics of practical endoscopy and come back to train the rest of the team. The minimum lifespan of an endoscope would be 5 years if treated properly, and Merivale has averaged at least one foreign body or is presented with signs of a foreign body since March of this year. As an estimate for future service, this would be 52 procedures a year, which is 260 procedures over 5 years, which is the minimum lifespan of the endoscope. This may be increased around December, January, as Christmas, there's lots of things to eat. So these patients would benefit from diagnosis or retrieval of the foreign body via endoscopy. The future demand for this would be high, similar to what we already have. However, the attachments purchased mean the more uses and procedures the endoscope could provide. Diagnosis, biopsies, and retrieval of foreign bodies would be its main uses. So the average endoscopy procedure can take up to 1 hour, depending on the experience or training of the vet and the anatomy of the animal. Providing this will be a vet completing the procedure, the median of a veterinary salary is $127,500 according to careers.gov. So the hourly rate of a vet, assuming that they're working 40 hours a week and 52 weeks of the year, would be $61.30 an hour. We also have to consider the veterinary nurse's wages, who will be required to monitor the patient throughout anaesthetic, and this average hourly salary would be $25 an hour, also according to careers.gov. So the vet hourly salary of $61.30 an hour and the vet nurse salary of $25 an hour would equal $86.30 staff wages for 1 hour. So I have made a chart of the consumables needed for this procedure. The total per patient is averaged at $11.86. There would be some variables, for example, how much tape is used, drug dosage depending on weight, and amount of needles, catheters used per patient. I've also chosen medetomidine and butorphanol as the sedation drugs, as that's what Merivale generally uses. However, this may differ from patient to patient, so this is a rough estimate, and this information is from Southern Veterinary Supplies. So here I have added a table of the total cost for each procedure and the charge to client amount. So the endoscope purchase divided by 260 procedures over 5 years ends up being $46.07 per patient/procedure. The training cost divided by 260 procedures over 5 years is $11.54, and per patient to cover investment cost would be $57.61 for the first 5 years of use. The consumables, including surgery gel, lube, sedation drugs, syringes, needles, catheters, ports, and tape, come to $11.86 per patient, and the staff wages again are $86.30 for an hour. So I've discussed with Merivale their markup, and they generally state about 20%. So the total clinic cost is $155.77, and with the 20% markup, the cost to the client is $186.92. So this would probably be the minimum cost charged to client, as we would also have to consider different scenarios, size of patient and complexity of the procedure, alongside other charges including hospital fees or the potential for fluid therapy and other expenses that may be included, which would be a case-by-case scenario. Overall, this is a much cheaper procedure for clients and much safer for the animal involved. Surgeries can be longer and require more equipment / anaesthetic drugs than an endoscope procedure. This can drive up the costs alongside staff wages, making the procedure more expensive. The endoscope eliminates the need for surgery, which can come with risks to the patient. It can be a longer period under anaesthesia and can cause trauma or complications once the patient is opened. This also means the patient has to recover from the surgery and let the wound heal without any interference. So an Elizabethan collar may be needed for up to 2 weeks, which can be stressful for the animal and challenging for the owner to manage. So So pain relief meds would also be needed, which can be hard for elderly owners to give to the animal. Therefore, an endoscope procedure should be justified to the patient as it's much cheaper and easier for the client and much safer for their pet. So, does anyone have any questions?
So just to confirm, you can't remove items from the large intestine with this?
So generally once it reaches the large intestine, it should be able to pass through by itself.
Right.
Yeah. Any other questions?
So I saw you said gastroscopy.
Yes.
How is that? Is that different from endoscopy
Yes.
or?
Endoscopy is just the general term for looking inside the body with a camera, and then gastroscopy is sort of for the upper GI tract, so the esophagus, stomach, small intestine, and then so the large intestine is more where things should be able to pass through, and then that is where things tend to get stuck.
Okay,
Yeah.
cool. Thank you.
Lovely, thank you.